Okay, everyone. Again, thank you for joining in today. This is going to be a seminar about UnitedHealthCare AARP Medicare Advantage plans in 2024. I'm Lisa, owner of Trozan Insurance, MVIP Inc., and we welcome you to this webinar. Thank you so much for participating. Everybody is muted right now except for myself. And we do have a chat box open. So if you look in your meeting controls, there should be three dots. And if you click on that, then you will be able to see the chat feature. We'll try to open up the microphones at the end of the meeting, but I haven't been that successful at it the past few meetings. So if not, you can chat with us. You can always call later. You can email with questions. We just want you to know that we're here and we're ready for your questions. So one thing you will see as you're looking at this first page is that I'm listed there and we have three other agents who are working in the agency now. We've got Amy Kilber, Leslie Shoecraft, and Zeke Kennison. So with that, that means I should be able to have a vacation at some point and not have to worry about the phones while I'm gone. It's a wonderful thing to have counterparts working with you. So we're going to go ahead and jump in. We will be talking about multiple kinds of Medicare Advantage plans within the UHC system. So just know that not all of these benefits are exactly what you have, but it's more about learning how to use the benefits than learning what exactly you have. Right. Get this page turning here. So very first thing, everybody should have their U card. The U card is a really important thing for you. Do you know why? It's your only card. So one of the things that sets United Healthcare out front and for this is that they have a single card for your medical, your prescription, your dental, vision, hearing, as well as your over-the-counter balance and any flex balance you may have. It is a really important card, so you want to hold on to it, and it will tell you what health insurance company you have. It will also tell you what plan you have, the name of your plan. And specifically, something to look at is right here. If it says with dental, that tells you that yes, you have dental coverage built into your plan. A lot of people that have had our United Healthcare plans for many years did not even realize that they had added dental onto it for no additional cost. So if that's you and you were not aware of that, you can always reach out to us to understand a little bit more about that dental, but it is built right into it. Then your name should appear here, and please make sure that it is your name with your correct middle initial if appropriate. Some people have had problems, not just with United Healthcare, but across the board with all companies, that if their middle initial is not correct on here, it may not be a valid card. So please verify that your name looks correct on there. Then next you will have your member number. That is your particular number with United Healthcare. These RX bin, RX PCN, and RX group, that is for prescriptions. So if your pharmacist ever needs those numbers, they'll call you and ask you to look for that. So that is what particularly pertains to prescription coverage. Then we've got a group number and an H number. This H number over here is actually assigned by Medicare itself. This is the number, the ID number for the plan that you guys are enrolled in. So United Healthcare did a lot of changes to plan names last year. We might have had a PPO2 in the past, and now it's considered a 0017. Whew, had us all swimming for sure. So plan names changed, and it was supposed to simplify things. We don't know yet whether that's truly the case or not, but we know that the names have changed on those plans. And so if you are confused about what plan do I really have, how do I know, those kinds of things, you can either check with us, you can look at your member materials that were mailed out to you about your plan, or you can call United Healthcare. Another great way is to use their online portal. So you can log in, you can create your username and password, and it will direct you right to information about your particular policy. So continuing on with this, your PCP, that is your primary care provider. Make sure the doctor that's listed there is the one you want to have listed there. If this is not a doctor that you're familiar with or one you don't want, you can change that doctor. It is not a difficult thing to do. You search out the new doctor that you're wanting from the provider network and notify UnitedHealthCare about that change. They will issue a new card for you with the correct doctor on it. This PCP number here is specific to that primary care provider. So that's going to be their phone number, and it should match what you have on file for that doctor. Then down here, there's a PCP copay. That's how much you would pay if you were going to your primary care provider, and a specialist copay. All of the things on the back of the card, the biggest thing for you to know is your member website up here, myuhcmedicare.com, as well as the customer service number. It's an easy one to remember. The others are all for providers and provider authorizations. So when you go to the doctor's office or you see a new provider and they want to take a scan of your card, this is all the information they're looking for. How do we get in touch with the insurance company to pre-authorize the procedures for this person? Then down here, you're going to see your UCard S3 network. So your over-the-counter benefits and anything like that that you actually have money loaded onto this card, this needs to be scanned by somebody holding a scanning tool at the checkout. So if you're trying to purchase over-the-counter items, they are going to need to use their handheld scanner to do that. There's also a card number listed here and a security code, just like a credit card has. So the important thing to know is that the S3 network is pretty comprehensive. And you'll see another screen coming up here that shows which stores that S3 network works with. So the U card, when you visit your doctor or pharmacy, you will use that card. If you're checking in at the gym to take advantage of your Renew Active membership, you'll use that card. Buying over-the-counter items, use that card. Redeeming rewards, if you're earning rewards, use that card. The card is smart, so it knows if you're buying over-the-counter items, it's only going to take it out of that wallet or that purse. And if you have a reward on there, it's only going to take it out of that. If you are going to the gym, it's not going to charge you for a box of Band-Aids. It's going to clock in that you went to the gym. Vision care, medical access, all of those things, that card is smart. So basically that barcode goes for 55,000 plus retail networks. It's the scanning system that they're talking about when they mention S3. So here, where can you use the U card? If you go to Walmart, Walgreens, King Soopers, Safeway, Albertsons, CVS, we don't really have Rite Aid around here, but also Dollar General has been added. And so I know towards the east, we have some of those. So when you go in and you're buying something that would qualify as an OTC qualified, that stands for over the counter. And oftentimes right on the sticker on the shelf, it will say OTC on it. So you know that's a qualified product. At any of these stores, if you have a balance left for your OTC amount and you scan that card, it should take that balance right off of your total. The one thing that I tell people, always use like your Safeway card or your King Soopers card first. Get the sale prices. So it'll take the discount off and then use your U card so that you're purchasing that item at a lower cost for you. And then you can use the U-card balance to pay off anything that you have left for your over-the-counter benefit. And then you'll pay the remaining total that's left over for items that may not have qualified, or if you go over the balance that you had remaining. So tech resources. UnitedHealthCare invests a ton in their technology. So there is a UCard hub, a mobile app, and you can go right into the App Store and search for UCard hub. And it will give you information on how to use your UCard. You can scan items like in this picture to see, does this actually count for it? You can also see what your credits are and keep track of it. You can type in a barcode. Sometimes when we have a barcode out there, it might be a little bit messed up on the side and the scanner can't quite read it. So you can type these numbers in all the way across there if you need to, and it will tell you whether the item qualifies for OTC. And just as a reminder again, too, that those OTC benefits can show up right on the sticker that's on the shelf. So if you're in store, that's a really handy thing. One of the things that most people did not realize is that you needed to activate that U card to use the barcode. Not to go to the doctor, not to use it at the pharmacy, but to use your OTC benefits from the U card, you need to activate it. So you can visit activate.uhc.com. That's an activation landing page. You can call this number and enter the 17-digit barcode number. And if you have questions related to it, you can always call the customer service number on the back of your card. So one of the things that I would like to mention in this area is that it is important to use the number that is on the back of your card, because UnitedHealthCare has really tried to make phone availability for the people that are calling from the area where they live in. Plans all the way across the country are different from each other. So what somebody has in New Hampshire is likely vastly different than what we have in Colorado. So your number cues you into the member services team that you are from Colorado and you have a Colorado plan. They try to match you with someone on the phone that knows the Colorado plans. So it is really important to use the number on the back of your card. Super important if you can. They can't always match you with a Colorado specific person answering the phone either, but they do as much as they possibly can. So here's another way that you can activate it. This is how you can get the mobile app for UnitedHealthCare. And we will be sending out these screenshots for you. So you'll have this in your email inbox, and you'll also have a copy of this recording. But if you hold your cell phone up and turn the camera on and point it right at that QR code, so that's right in your camera shot, it's going to bring up the ability to click on a link and it will take you right to that app so that you can download it. Pretty handy little tool. And that will give you the mobile app, and that helps you to really use your benefits. Member services. I guess we just talked about this already. They are your UnitedHealthCare team. So they are trained state specific. And like I said, they're not always available for every call that comes in. If too many people from Colorado call at the exact same time, you might not get a Colorado representative. Over-the-counter items. By far, most of our questions from UnitedHealthCare come about this U card and how to use it for your OTC products. OTC, or over-the-counter, really can be anything from vitamins and supplements to Tylenol, Advil, bunion care, diabetes care, first aid, smoking cessation. It can also be things like probiotics, sunscreen, toothpaste, lotion, all kinds of things. Now, there are limitations to it. So something to keep in mind is if you're trying to purchase Disney Band-Aids, you're not going to be able to do that. Character themed things, they kind of want you to stick with the basics. You can't purchase essential oils or pet products or baby formula, no alcohol, tobacco, or firearms. Renew Active. This is one of my favorite parts of the United Healthcare policy. I think Renew Active is a fantastic program for members. There are more than 23,000 gyms in network for you to access. So it is comparable to Silver Sneakers. However, the Renew Active program is broader, has more gyms involved. And they also have a lot more on-demand and live streaming classes. You can connect with others in the classes. They can be live streamed, meaning like this, where we could see each other if you had your cameras on. And then you can also connect with people through chats on that. Staying Sharp is a program that has brain health and brain activity games. I don't know if you like to play those, but I think they're great fun. You also get an annual personalized fitness program for you. Whether you live close to a gym and can go in and get that fitness program, or calling customer service if you are, say, an hour from the gym and you're not going to drive to a gym every day, you can still get a home fitness program designed for you sent directly to you. For certain plans, you can earn rewards for staying active. That free gym membership is not just locally, it goes all the way across the country. So if you are a big swimmer and you go and swim every day, but when you're going to visit family, you're like, oh, I'm not going to be able to go swimming the whole time. I'm going to lose that momentum. You can actually find a Renew Active facility near where you're going to be and still continue that process. One of my favorite things here is that you can bring a family member or friend to the gym to assist you in your workout. So they don't have to have a Renew Active membership. You can invite somebody to come in and work out with you, keep you motivated, make sure you don't lose your balance, spot you on the weights, join you in a class. And then again, all the on-demand workouts and streaming fitness classes for home use, there are literally 20,000 to choose from. So it's hard not to find something for yourself. They can be as simple as in-chair fitness, strengthening for balance, and all the way up to things like kickboxing, Zumba, and Tai Chi. So there's tons and tons to pick from. You can also participate in social activities with the local health and wellness classes and access to the Fitbit community. Remember, you don't need an actual Fitbit to participate in this, but you do get Fitbit classes and the Fitbit community. And then, of course, the Staying Sharp program. Take advantage of that. It's actually really quite fun. So you do need a confirmation code that you will get from AARP United Healthcare to use Renew Active. You log into your member portal, go to Health and Wellness tab, and then Renew Active. Or call the customer service number on the back of your ID card. They can get you set up with it. Another way that you can get set up is by going right to the gym. If they are Renew Active members, then the gym can help you sign up. To get the at-home option, call customer service, the number on the back of your card, and say, I want my at-home gym option. And then Fitbit community for Renew Active, you don't have to have the Fitbit, but you do have to have the mobile app. So that is something in the App Store to go get. Hearing benefits. Hearing is something that affects our balance. It affects our cognition, how we interact with people, and it affects our social health. So the hearing benefit allows you to have a choice of 2,000 plus hearing aid models and styles at very significant savings. I suggest to every single member to go get your baseline hearing test. It is super important. You also have, if there is hearing loss, You have 60 days to try out your hearing aids. And that's a really good thing to do because one of the things that can happen if you've had hearing loss for a very long time and you put those hearing aids in, it can be really disconcerting at first. And so trying them on in the doctor's office, everything may work okay, but then you go out in public, you're like, I can't take this. It's like you have to get used to hearing all that information again. So it does take some time to kind of work into it. But at the end of that trial period, if you're not happy with it, you do not have to keep them. So you can get your money back on that. To use your hearing aid benefit, you're going to visit the uhchearing.com/Medicare or call this number right here, 855-523-9355. Again, remember you'll have these slides. You'll learn more about hearing care and hearing aid options, and they will schedule a hearing test with you. So you'll receive that hearing test. You can order hearing aids, receive the hearing aids, either in person or through direct delivery. So for these things, remember that customer service is open from 8 until 8, Monday through Friday. Or you can take an online hearing test if you prefer. Vision benefits. So vision benefits through UnitedHealthCare have changed a little bit over the past couple of years. This is not something you would find on a supplement policy. So this is not covered by original Medicare. These are added benefits from UnitedHealthCare. You will have a yearly routine eye exam, and then you have some savings on a range of eyewear. You have zero copay on your yearly exam, and then you can also have different allowances for your eyewear. One of the things that you want to understand is that access is through mail order. So your frames and whatnot you can get through Warby Parker, Glasses USA, and you can also get the contacts through UHC Contacts or 1-800 Contacts. Your dental coverage. So this is the exciting one again. Dental coverage is so important to our entire body health. The health of your mouth can affect your heart health. It can affect your brain health. It's a real inflammatory process. So even those simple exams and cleanings, as much as we may not like to go in and have them done, they're really important. You do have dental on your plan. If you need help understanding how much dental or what it covers, let us know. The best way to take advantage of your dental is to have your dentist do a pre-authorization for you. So right here, how to use your dental benefit. Find out if your doctor is in network. You can call UnitedHealthCare, you can log into your member portal, or we can also do a search for you. Conversely, you can just show your ID card to your dental office. Look, I have dental benefits on here. It says right there. Can you check and see if that would help me with this bill? The dentist should be pre-authorizing that procedure and giving you an estimate before doing a procedure. If you end up paying, you can submit the claim for reimbursement. All you do is go to uhcdental.com and follow the directions that are on that page. It will say something to the effect of, I want to submit my own dental claim. Then when you do that, UnitedHealthCare will reimburse you. They won't send it to the dentist, they'll reimburse you because they know that you've paid for it. Flex benefits. Most of the plans that we have in Colorado do not have flexible benefits for dental, hearing, and vision. So in this case, it would be if you also had Medicaid state assistance for your health care rather than Medicare. Or sometimes people will have both Medicare and Medicaid. If you did end up qualifying for Medicaid and went on to a dual plan, dual meaning Medicare and Medicaid, then you do have some extra dental, hearing, and vision flexible benefits. Network importance. So we all want to keep our health plans from rising in costs. And here we want to talk a little bit about the difference between a PPO and an HMO. An HMO, also known as a health maintenance organization, means that you should exclusively get care from your network providers to have that care covered. If you go outside of the network and receive care from a doctor who does not take the plan, an out-of-network doctor, then you would be responsible for those costs unless it's an emergency. Emergencies always eliminate that. We can't look for someone in network when we're having an emergency. A PPO offers flexibility in exchange for maybe lessened benefits in some areas, higher copays, or maybe a higher maximum out of pocket. In other words, flexibility does cost you a little bit. But overall, what we're trying to encourage in any health plan that we look at is that you have primary care or a medical home. It's someplace where you is your go-to place when something is going wrong. It could be a whole clinic of physicians. It could be a UC Health clinic. It could be Village Medical, for instance, or it may be a single doctor professional. That person provides you with coordination of care. They're able to review your medications, to help make referrals for doctors that you may need to be referred to or specialists. And they also help provide continuity of care. Continuity, really helping you to understand what the other doctors have told you, making sure that medications aren't interacting with each other. They are truly your medical home. So as I talked about, out-of-network coverage will either be a higher shared cost or not covered if you've chosen to go out of the network, unless it's an emergency. Okay, guys, thank you so much. That is the main gist of UnitedHealthCare. One of the things that UnitedHealthCare has really done over the past couple years is they have stayed really, really consistent with their plan offerings. They have made things, they're trying to simplify things, changing the plan names, and staying consistent, keeping a consistent product so that there's not so many surprises for you, not so much learning curve. The U card a few years back was a huge improvement. So that one-stop shop in one card is really fantastic. I encourage you to ask questions. I encourage you to reach out to us anytime you're wondering, do I have that benefit? Where can I find that? Your benefit summary is a fantastic resource for that. So it is about a 12 to 14 page plan identification. It shows you what things are covered for what copays, what extra benefits you have. The evidence of coverage, on the other hand, is really your plan description of benefits, just plain medical benefits, prescription benefits. It's 300 pages long. So I don't recommend printing that. They're always available online. You can ask about them. You can have the insurance company print it and send it to you if you wish. But just know they can change from year to year. They're trying for consistency, but small things do change. Remember, we are here for your questions year-round. We are not a, seasonal business. We are on the corner of Mulberry and Stover and have been for years, and will continue to be there. So please reach out to us. Let us know what questions you have. And we really appreciate you taking time to learn about your plan and to engage with your plan.